Welcome everybody, my name is Jon Rouse and I'm the Chief Officer of the Greater Manchester Health and Social Care Partnership. I'm sorry I can't be with you today for this very important workshop on the Workforce Race Equality Standard. When Greater Manchester took charge of its health and care in April 2016, one of our principal drivers for doing so was tackling levels of inequality within our city region. Many of our deprived areas have very high levels of ill health that acts as a drag on the individual's ability to get on in life, but also on our economy as a whole. It reduces the social contribution that they can make. And it has to be said that race equality and race inequality is right at the heart of this, given the pattern of those communities in our most deprived areas. Now we need to address that, of course, through all our health and care programmes, our population health programme, what we do at a community level, and the way we deliver acute care. However, we also can make a difference through our workforce strategy. We've set up in Greater Manchester a workforce collaborative that has got a number of key priorities. One is that we grow our own talent. That's a good thing to do anyway, given the depleted workforce in parts of the NHS and social care. But it also means that we can draw people from those deprived communities into work opportunities throughout our NHS and social care. We can also plug difficult gaps in our workforce where we know we've got shortages by attracting new talent from home and abroad. We can also create a more flexible workforce and giving people opportunities to progress in terms of their careers. Whichever of our workforce priorities you focus on, you come back to race equality. Because the reality is that the pattern of our workforce right now is not representative and not reflective of our population. And that doesn't work for us in terms of devolution and the partnership that we are trying to secure and achieve. We want a workforce that is representative of our wider population. That's why we're partnering with the Workforce Race Equality Standard, or RES for short, because they've created an evidence-based framework that allows us to take the right measures in the right organisations to change the current pattern. And that's going to need leadership from across all our organisations in Greater Manchester. Certainly the big NHS trusts as our major employers, but actually every CCG, every local authority, into our social care system, into our primary care system. We need to make a change across the board. In particular, we need to start at the top. Our senior leadership within Greater Manchester really isn't reflective of our population. And it bothers me and it bothers many people that we do not have diverse leadership that reflects our population. We need to change that. But to change it, you have to be systematic about it. There are actions you can take in the way you recruit, the way you retain, the way you train, all sorts of processes that if you adapt and adjust them, can over time lead to more people from BME backgrounds getting the senior leadership jobs. It's not that we're short of talent in Greater Manchester within our BME communities. We're overflowing with talent. The question is, are we going to allow that talent to thrive, to come through? Or are we going to be the blockage and create barriers to those people realising their potential? So that's your task today, to start that process of beginning to put together a plan using the Workforce Race Equality Standard as to how, over the next few years, we can change those patterns, we can create real race equality through our human relations and organisational development work and end up with the diverse workforce and the diverse leadership that we're looking for.